Today we are tackling some of your most pressing questions about heart health. Many of our viewers sent their questions or concerns to abcnews.com, and we've got your answers straight from the expert. Joining us today is ABC News contributor Dr. Chris Magovern. Dr. Magovern, great to see you again.
Good morning. Great to be here, Tanya.
So we got some really interesting questions, and they are a little technical, many of them. So you'll have to explain what they're asking before you answer it.
Will do.
We'll dive right in with the first question from an unknown viewer asking, I'm a 52-year-old woman who was told I have a slight ischemia on the lower left side of the heart. What is this, and will anything improve it?
She is describing a portion of her heart that is the left lower chamber of her heart, which is the working chamber. That's the most important part of the heart that pumps blood to the rest of the body. And she's describing ischemia. Ischemia means poor blood flow. So that part of the heart, the most important part of her heart, is not getting enough blood. And that's because the arteries that supply blood to that area are blocked. So is that a problem? Sure, it could be. If it's mild, it may not be. But if it gets significant, it may jeopardize the blood flow to that part of the heart. It could cause chest pain. It may weaken the heart muscle. It might even cause a heart attack. So I think for her, the single most important thing she should do is get a diagnostic test called a cardiac catheterization. This is a procedure that defines how blocked the arteries are, and it gives us a better idea about what we might have to do.
And then how would you treat this problem?
There are three general ways that we treat this problem, Tanya. One is simply with medicines. Medicines may make the symptoms go away. Angioplasty, which is a procedure cardiologists perform by putting stents in the arteries and stretching them open. And the third is heart surgery. What we do as surgeons, we reconstruct the blood supply to the heart. So it would be one of those three.
And of course you have no way of knowing without examining her how severe her ischemia is.
That's exactly right.
All right, well, good luck to our 52-year-old anonymous viewer there. Our next question is from Carrara, and this viewer asked, can AFib be cured? First of all, what is AFib?
Okay, well, the short answer is yes, it can be, but AFib is atrial fibrillation. It's an irregular heart rhythm. It's very, very common. It's not a particularly dangerous rhythm, but it's a nuisance. The heart normally, it has two chambers, and the heart normally beats in synchrony, the top chamber and the bottom chamber. And with atrial fibrillation, the top chamber doesn't beat properly. It sort of wiggles. And the bottom chamber continues to work, but the heart doesn't pump as efficiently. It's sort of like a car that isn't firing properly. It's not as smooth, and you feel rotten. We have ways of trying to fix atrial fibrillation with medicines and sometimes using electricity, but in order to cure it, you have to understand how it starts in the first place, and it's an electrical problem. In the heart, electricity goes through in an organized way to get the heart to beat. With atrial fibrillation, there's a short circuit. Instead of going straight, it goes around and around and around in circles. And in order to stop that, you have to actually get into the heart and stop that pathway.
So it requires surgery?
It requires surgery. And there are two forms of surgery. They're either done by heart surgeons while you're in there performing open heart surgery. We can make lesions inside the heart to interrupt that pathway. Or more commonly, Tanya, it's performed by specialized cardiologists called electrophysiologists that feed a catheter from the groin up to the heart, and they can actually burn scar tissue on the inside of the heart to stop that pathway.
Wow. So
that's
it sounds like it can be life-threatening then.
The atrial fibrillation, not necessarily life-threatening, but it's a quality of life issue. People feel rotten because they feel the heart palpitating.
Is it painful when that?
It's not painful, but you just feel like you've just run a 100-yard dash and you can't get your wind. You feel rotten.
Right. All right. So that's Carrara's answer. We hope you are feeling better and can get that looked into. Now, we have another anonymous viewer who asked, what is the life expectancy for a patient that has been diagnosed with low ejection fraction of 40% or lower?
An ejection fraction, what is that?
Yes.
Right.
First question.
Our hearts are pumps. They pump blood to the rest of the body. And we can gauge how well the heart is working or how poorly the heart is working by how much the heart pumps out or how much it ejects. A healthy heart like yours, when it squeezes, pumps out 75–80% of the blood that's in it. A weaker heart, like this example, only pumps out 40%. So imagine that every time that heart beats with a 40% ejection fraction, only 40% of the blood leaves the heart, 60% of it stays in.
And that can cause problems,
It
correct?
can.
Yeah.
It can. It can lead to heart failure. And heart failure, it can be as dangerous as some cancers. Elizabeth Taylor just this week died from heart failure, which was the exact same problem.
From this exact problem?
Yeah,
where
that's
her
what heart failure is
was
from.
not pumping the blood efficiently.
That's exactly right. And these are the numbers, Tanya, we know. If your ejection fraction is 35%, if left untreated, you have only a 40% chance of living 10 years. And if your heart's weaker and it's only squeezing 25%, you only have a 20% chance of living 10 years. So it's a significant problem. And your longevity is very much tied to how well your heart works.
And it's a common problem, correct? Didn't Dick Cheney recently
That's
also
exactly
suffer
right,
from this?
yes. Dick Cheney's heart was so weak it was probably on the order of 10 or 15%, so only a fraction of the blood was leaving his heart. We have different ways of treating these patients. Dick Cheney had a very specialized pump put in to restore his function.
Right, and so you have to be relatively healthy to have these pumps put in the first place.
To have what Cheney had, you have to be reasonably healthy, or you expect that person to live at least 5 years.
Is this a very common condition?
Heart failure is a very common condition, absolutely, and it's progressive.
What tends to cause it?
Great question, too. The underlying reasons are usually poor blood supply to the heart. It can be structural problems with the heart, either congenital problems with the heart or valves that don't work. If a valve leaks, it overloads the heart and makes the heart work harder. And these are the kind of things that we can fix. So if it's a leaky valve or it's poor blood flow to the heart, we can fix that with heart surgery, and we can make the heart pump better, and then patients will live longer.
Fantastic. Thank you so much, Dr. Chris Magovern, for answering our viewer questions, and thanks to our viewers for writing in with those questions and concerns. And to get more information on everything we've talked about today, log on to the health page at abcnews.com for all the latest health news.